viewers, welcome to the lecture series of Drugs and Pharmaceutical. In previous series, we discussed about viruses, which are intracellular invaders that alter the host cell's metabolic pathways. Then we discussed about antiviral drugs, antiretroviral drugs and anti-leprosy drugs also. Antiviral drugs act by preventing viral penetration of the host cell or by inhibiting the virus production of RNA or DNA. In this lecture, we will be discussing some central nervous system agents like phenobarbital and diazepam. Then we will discuss about cardiovascular agents like glyceryl trinitrate. So, drugs acting in the central nervous system were among the first to be discovered by primitive humans and are still the most widely used group of pharmacologic agents. What is central nervous system? It is made up of brain and spinal cord. It acts as control for regulating physical and mental processes. So, the brain is a collection of about 10 billion interconnected neurons. There is a pic of neuron you can see. This is dendrite, this is axon and this is axon terminal. Each neuron is a cell and that uses biochemical reaction to receive, process and transmit information. Let us discuss what is synapse. The synapse is a small gap separating neurons. It is a junction between the terminal of a neuron and either another neuron or a muscle or gland cell, over which nerve impulses passes, and there are approximately 10 to the power 14 of them in the human brain. Synapses are the means by which neurons communicate with each other, and synapses pass information and play a crucial role in processing the information. There are two types of synapse. First one, most synapses are chemical and will therefore be the focus of the learning activities in this course. And second one is electrical synapse. These are able to transmit nerve signals very fast and directly across a very small gap between two nerve cells. Let us discuss what is neurotransmitters. Neurotransmitters is a chemical substance that carry messages from one neuron to another or from a neuron to other body tissues such as cardiac or skeletal muscles. A substance norepinephrine, acetylcholine, dopamine or hormone that is released when the terminal axon of a presynaptic neuron is excited, and they acts by exciting or inhibiting a target cell. Receptors. Receptors are the proteins embedded in the cell membranes of neuron. A neurotransmitter must bind to receptors to exert an effect on the next neuron in this chain. Let us discuss what happens at synapse. When an action potential arrives at the axon terminal, it triggers the opening of calcium channel in the membrane of that neuron. This in turn triggers the release of the neurotransmitter from the vesicle it is stored in into the synaptic fissure. Then the neurotransmitter then diffuses across the space between the two neurons and bind the specific receptor on the membrane of the postsynaptic neuron, and the interaction between the receptor and neurotransmitter and may either stimulate or inhibit the initiation of an action potential in the second neuron, that is, it may be excitatory or inhibitory. There are two main types of receptors. One kind of receptor is directly linked to an ion channel in the postsynaptic membrane, and The other type of receptor is not directly linked to an ion channel, but has its effect by signaling the production of a second messenger. The second messenger can lead to many changes in the postsynaptic neuron, including the opening of ion channels in the plasma membrane. These receptors support more complex and long-lasting effects to occur in the postsynaptic neuron. Here you can see schematic drawing of steps at which drugs can alter synaptic transmission. First step is action potential in presynaptic fiber. Second is the synthesis of transmitter. Third is storage. Next step is metabolism and then release. Then you can see reuptake here. In next step, degradation takes place and receptor for the transmitter is next step. And finally, receptor induced increase or decrease in the ionic conductance. Let's discuss about some drugs that depress the central nervous system. Depressing central nervous system means drugs can cause the brain to be calm. Like sleep is the effect, anesthesia, in overdose it can cause coma and death. Another kind of drugs that can affect central nervous system, they can stimulate the central nervous system. It means drugs can stimulate respirations. They can keep a patient awake but the overdose can depress appetite. Let's discuss about the types of depressant drugs. Mild CNS depressant decrease interest in surrounding and inability to focus, while moderate CNS depressant cause drowsiness or sleep and decrease perception of heat or cold. Severe CNS depressant, they cause unconsciousness or coma, loss of reflexes, respiratory failure and death. Let's discuss about the types of stimulants. Mild stimulation cause wakefulness, mental alertness and decrease fatigue, while moderate stimulation cause hyperactivity, excessive talking, nervousness and insomnia. Excessive stimulation cause confusion, seizures and cardiac dysrhythmias. Let's discuss about some central nervous system drugs. Tranquilizers. These drugs cause calm to animals, reduce anxiety and aggression. Anti-anxiety drugs. These are used to lessen anxiousness but do not make animals drowsy. Sedatives. Sedatives are used to quiet excited animals. They decrease irritability and excitement. Anticonvulsant or anti-epileptic drugs. These drugs prevent seizures by suppressing the spread of abnormal electric impulses from the seizure focus to the other areas of the cerebral cortex. All anticonvulsants are CNS depressants and may cause ataxia, drowsiness and hepatotoxicity. The examples of these drugs are phenobarbital, diazepam, chlorazepate. Analgesics. These drugs relieve pain. Narcotic analgesics are used to moderate to severe pain. Narcotic refers to opioid or opioid-like products. It produces analgesia and sedation and relieve anxiety. The examples of narcotics are opium, morphine sulfate, atropine, buprenorphine, pentazocine. Neuroleptic analgesics. It is a combination of an opioid and a tranquilizer or sedative. It can cause a state of CNS depression and analgesia and may or may not produce unconsciousness. The example of these kind of drugs are acetaminophen and morphine is the combination, and xylazine and butorphanol is another combination. Let's discuss about sedative drugs. Sedative drugs reduce anxiety and exert a calming effect with little or no effect on motor or mental function. Sedatives are given during waking hours because it may cause drowsiness. Let's discuss about hypnotic drugs. Hypnotic drugs produce drowsiness and encourage the onset and maintenance of a state of sleep that as far as possible resembles the natural sleep state. Hypnotic drug is given at bedtime with the purpose of inducing sleep. Hypnotic effects involve more pronounced depression of the central nervous system than sedation, and this can be achieved with most sedative drugs simply by increasing the dose. Graded dose dependent depression of central nervous system function is a characteristic of sedative hypnotic drugs. Let's classify the sedative hypnotic drugs. First one category is benzodiazepine drugs, barbiturates and other classes of drugs. Benzodiazepines. These drugs, they do not lead general anesthesia and rarely they cause death. Second category of barbiturates is these are the older sedative hypnotic drug, general depression of central nervous system. With such drug, an increase in dose above the needed for hypnosis may lead to a state of general anesthesia. At still higher doses, it may cause depressed respiratory and vasomotor centers in the medulla, leading to coma and death. The other classes of drugs are chloral hydrate, buspirone, etc. Let's discuss about the pharmacological effects of benzodiazepines. These drugs affects the hippocampus and nucleus accumbens and reduce anxiety and aggression. They cause sedation and induction of sleep. The latency of sleep onset is decreased and the duration of stage 2 NREM sleep is increased. From this drug, the duration of slow wave sleep is decreased. Benzodiazepines can enhance GABA mediated synaptic systems and inhibit excitatory transmission. The benzodiazepines are anticonvulsants and anti-seizures. They relax contracted muscles in joint disease or muscle spasm. They lead to temporary amnesia, they decrease the doses of anesthetic, they depress respiratory and cardiovascular function. Let's discuss about the history of benzodiazepines. The first benzodiazepine, chlordiazepoxide, was synthesized in 1961. There are some examples of benzodiazepine drugs: alprazolam, flurazepam, lorazepam and chlordiazepoxide are the examples. Let's discuss the mechanism of action of benzodiazepines drugs. Benzodiazepine binds with benzodiazepine receptors in the nerve cell of the brain. These cells also have binding sites for GABA. GABA stands for gamma aminobutyric acid. It is an amino acid that inhibits nerve transmission in the brain. Benzodiazepines and barbiturates work by increasing the action of GABA in the brain. Now, let's check the adverse effect of benzodiazepines. They cause central nervous system depression, drowsiness, they cause lightheadedness, insomnia, excitation, respiratory depression. Hypotension is also an adverse effect and nausea, vomiting, constipation or diarrhea are the observed adverse effect of benzodiazepines. Let's discuss about a drug diazepam. This is the chemical structure of diazepam. It is used as an anti-anxiety, as anticonvulsant, as sedative and hypnotic drug, and as a skeletal muscle relaxant. Synthesis of diazepam. The cyclocondensation of 2-amino-5-chlorobenzophenone with the ethyl ester of glycine hydrochloride gives 7-chloro-1,3-dihydro-5-phenyl 2H-1,4-benzodiazepine 2-one. In next step, the amide nitrogen atom of the obtained 7-chloro-1,3-dihydro-5-phenyl 2H-1,4-benzodiazepine 2-one is methylated by dimethyl sulfate, which leads to the formation of diazepam. This is the pic of synthesis of diazepam. In first step, cycloaddition takes place, and in second step, methylation takes place, and we get diazepam is the final product. Let's discuss about a drug phenobarbital. This is the chemical structure of phenobarbital. It is used for the treatment of seizure, for the treatment of status epilepticus, and for detoxification of alcohol and benzodiazepine. Let's discuss the chemical synthesis of phenobarbital. In first step, the ethanolysis of benzyl cyanide in the presence of acid takes place, which give phenyl acetic acid ethyl ester. Then the methylene group of which undergoes acylation using diethyl oxalate and gives diethyl ester of phenyl oxobutanoic acid. You can see this is the first step, ethanolysis of benzyl cyanide takes place, and here the next step by which we get the final drug phenobarbital. Let's discuss about barbiturates. These drugs depress the central nervous system at all level in a dose dependent fashion. Now, it mainly used in anesthesia and treatment of epilepsy. It is used as sedative hypnotic agent, is no longer recommended. Let's check the mechanism of action of barbiturates. Barbiturates share with benzodiazepine the ability to enhance the action of GABA, but they bind a different site on the GABA receptor, that is chloride channel, and their action seems to prolong the duration of the opening of GABA activated chloride channels. Let's discuss the therapeutic use. The barbiturates used as sedative hypnotic agents. It is used in the emergency treatment of convulsions as in status epilepticus. It is used in combination with antipyretic and analgesics and in the treatment of hyperbilirubemia. Adverse effects of barbiturates are dizziness, drowsiness, amnesia, impaired judgment, insomnia, tremor, disorientation, skin eruptions also, hallucinations, anxiety, and sometimes convulsions. Do you know which is the most widely used sedative or hypnotic? Alcohol. Alcohol is act as a stimulant and depressant. It stimulates the adrenal gland, it depresses the CNS and act as a diuretic, but it increases gastric acidity also. There are some adverse effects of alcohol, that is confusion, diarrhea, insomnia, agitation, fever, hypertension, severe anxiety, and sometimes fear of death. Let's discuss what is depression. Depression is the deficiency of norepinephrine and serotonin which leads to monoamine neurotransmitter. And there are some neuroendocrine factors also, like increase in corticotropin releasing factor and some hormones. These are the types of antidepressant drugs. First one is tricyclic antidepressant, selective serotonin reuptake inhibitors, monoamine oxidase inhibitors, and some unclassified drugs. Let us discuss about cardiovascular agents. Cardiovascular agents are those drugs which act on heart and vascular system. These drugs are used for the treatment of angina, cardiac arrhythmia, hypertension, hyperlipidemia, and disorders of blood coagulation and platelet aggregation. Let us check some different types of cardiovascular drugs: anticoagulants, anti-anginal drugs, antihypertensive drugs, hypoglycemic drugs, antiarrhythmic agents, vasodilators, cardiac glycosides are different types of cardiovascular drugs. Anticoagulants are those drugs which prolong the coagulation time of blood. The drug associated with phenomena of blood coagulation may be discussed under anticoagulants, antiplatelet drugs, and hemostatics drugs. Antihypertensive agents. Hypertension or high blood pressure is the name of a pathological condition in which blood pressure is persistently elevated. The blood pressure is a measurement of the pressure of the blood against the blood vessel walls. The persistent high blood pressure puts undue stress on the heart, blood vessels, and other organs. Cardiac glycosides are an important class of naturally occurring drugs whose actions include both beneficial and toxic effects on the heart. Vasodilators. Vasodilators are certain drugs having cerebral and peripheral vasodilating, that is expansion of the blood vessels effect. Mainly under these category, arterial vasodilators and arterial and venous dilators are included. Let us discuss about anti-hyperlipidemic agents. The pharmacological agents which reduce the concentration of plasma lipids are called hypocholesterolemic agents or anti-hyperlipidemic agents or lipid lowering agents we can say. Let us discuss about antiarrhythmic drugs. Antiarrhythmic drugs may be defined as drugs that are capable of reverting any irregular cardiac rhythm or rate to normal. Antiarrhythmic agents are also termed as antidysrhythmic drugs or antifibrillatory drugs. Let us check what are hypoglycemic agents. These are those agents which are used to lower the blood sugar and are used to treat the symptoms of diabetes mellitus. Anti-anginal agents. The English word angina refers to a painful, choking, constriction or tightness somewhere in the body. The anti-anginal drugs are directed mainly to alleviating the preventing anginal attacks by dilating the coronary artery. Let us check what is this angina pain or angina pectoris. Angina pain develops if part of your heart muscle does not get as much blood and oxygen as it needs. It is usually caused by narrowing of your coronary arteries due to a build-up of a fatty substance called atheroma. The narrowing makes it more difficult for blood to flow to your heart muscle. Let us classify these anti-anginal drugs. These are nitrates and nitrites. Examples are nitroglycerine, erythritol, tetranitrate, amyl nitrite, sodium nitrite. Second category is calcium channel blockers. Benzothiazepine, its example is diltiazem. Dihydropyridine derivatives, example is nimodipine, and aryl alkyl amine derivatives, the example is verapamil. Next category is beta adrenergic antagonist, the example is propranolol, and miscellaneous coronary vasodilators, the examples are dipyridamole and papaverine. Let us discuss about nitroglycerine. It is an organic nitrate and available in many forms as a vasodilator. Vasodilator agents are those drugs which are used to cause expansion of the blood vessels. Let us discuss about the synthesis of nitroglycerine. This is simply nitration of glycerol by using HNO3 and H2SO4. We get nitroglycerine by nitration of glycerol. Nitroglycerine acts by decreasing cardiac work and reduce oxygen demands. Let us discuss about the therapeutic effects of nitroglycerine. This drug is used in the treatment of angina pectoris, in perioperative hypertension. It is used to treat hypertensive emergencies. It is also used to produce controlled hypotension during surgical procedures and also to treat congestive heart failure. Now, let us discuss the mechanism of action of glyceryl trinitrate. There are two different ways how do they work. First is it relaxes blood vessels in our body, causing them to widen, and this reduces the strain on our heart and making it easier for our heart to pump blood. Another way is it also relaxes and widens the coronary arteries, which increases the flow of blood to our heart muscle. So, viewers, this is the end of drugs and pharmaceutical lecture series. In this series, we discussed about drugs, their designing, and some specific agents like analgesic, antipyretic, antimicrobial, and antihypertensive drugs, and many more drugs. Hope you enjoyed this lecture series. Thank you.